Yes,
Good
doctor, we can
morning.
hear you loud and clear.
Good morning, good afternoon, good evening to all from different parts of the world. Today, 14th July 2023, our continuous Zoom meeting, 1047th day. Today, we welcome all from different parts of the world. Today, our guest is from Pakistan, Dr. Elahi Bux. Let us have a 1-minute silent prayer before starting our session to get blessings from God. Thank you all. I told you that our guest is Dr. Elahi Bux, MSc Physiology, MA Sociology, and DHMS. Former Assistant Director, Ministry of Health, Government of Pakistan. Member, National Council for Homeopathy, NCH, Government of Pakistan. Chairman and Act Rules and Regulations Committee, NCH. Former member, Task Force for Directorate, Anti-Quackery, Synth Healthcare Commission. Co-opted member, Committee on Advertisement, Drug Regulatory Authority, Pakistan, Government of Pakistan. Nominated as member of TAC, Synth Healthcare Commission. His email is also given. So today, his subject, Rome for functional disorders and homeopathic principles of treatment. You know that this is a condition of abdomen. Normally, we are not more aware or more given importance to that condition. That is burning of heartburn and bloating of abdomen and gas formation and everything. So this is normally we will ignore in our younger ages, but after that it will become a great problem for many of us. So patients are coming from this condition today. I think that Dr. Are you joined, sir? Is our guest is joined?
Yes, yes, sir.
Okay, sir. Okay, thank you very much, sir. You are most welcome to our platform. There are so many people out there waiting for you. And you are dealing a subject that is very important. Common men, always feeling common men's problem. So you can start, sir. Sir, now for the 45 minutes, your lecture will be there. And after that, there will be a discussion part. So you have to arrange the time for this. Okay, sir, you are welcome.
Thank you. Thank you, Dr.
Start,
Habak.
sir.
Okay. I appreciate the IFPH for its 1047th continuous sitting on homeopathy. This is really a promoting event and effort of the IFPH management, and I extend my thanks to allow me to speak here. Today, my topic is Rome 4. What is Rome 4? First, we have to discuss the Rome 4. Rome 4 is nothing but a forum which have decided about the functional disorder of gastrointestinal tract. It means all the diseases which are functionally disturbed can be included in the Rome 4. Rome 4. Rome, what is Rome? It was that's why it was I think that the doctors have convened their meetings and they have collectively decided in the Rome. That's why it is called Rome criteria or Rome diseases or Rome functional disorder of gastrointestinal tract. So these are the diseases which are correlated with the homeopathic philosophy. Functionally disturbed gastrointestinal tract means the functional disorders or FGIDs. It means functional gastrointestinal disorder. Common diagnosis is gastroenterology, are recognized by the morphologic, physiological abnormalities that often occur in combination, including the motility disturbance, visceral hypersensitivity, altered mucosal and immune function, altered gut microbiota, and altered central nervous system processing. You can see that all the things which are correlated with the mind, correlated with the brain, is included in this segment of disease or segment of our knowledge. You are also well aware that our gut is well wired with our brain, right from our developmental stage. When we were at the womb of our sorry womb of our mother, these wiring is developed within the gut and our brain. In the can you hear me?
Yes, sir.
I
Yes,
am
sir.
audible.
Okay.
Okay.
Okay, you are audible, sir.
Okay. Okay. These all the symptoms, all the diseases which are presumed as diseases in the past time, like peptic ulcer, like gastroenteritis, like bowel syndrome, bowel motility disorders, and colitis, and other things which may start from the mouth and end from the last part of the our GIT. All these were relate with the pathology or in the conventional way of treatment. It was presumed that there should be some lesion, pathological lesion, if we are feeling something not abnormally. If we are feeling something like heart burning, if we are feeling regurgitation or refluxes, if we are feeling something like colic pain, if we are feeling something like motility, increased motility, it was meant that there is something wrong in our physiology, something pathology have been established. But with the passage of time, the medical fraternity or medical sciences have observed that there are so many things, there are so many events, there are so many occasions where the patient is asking or saying about his disease or saying about his discomfort, but the pathological reports or available testing phenomena is showing that nothing is present in his body. So pathologically, we can say that there is nothing, and the patient is all right about the health, and there is no disease in the body of the patient. But with the passage of time, the doctors have realized that there is something else other than the pathological lesion. This turning point get created a new horizon or new path in the medical science and Thus, they will able to realize that there is not a disease, but there may be some illness. This illness called the functionally disturbed our GIT. So this functional disturbance is not evaluated in one time. It have lastly or in the near past in 2016, they have evaluated, they have refined the symptoms of the gastrointestinal tract disorders 4 times. That's why it is called Rome 4. Rome disorder form or Rome criteria form 4. In the up to the day, they have evaluated the several form of the conditions which are functionally disturb our gut, disturb our intestinal flora, disturb our gastric tract. This includes our mouth, even if in homeopathy or in our practices, we can listen or people are saying or our patients are telling us that when I see the food, I feel something like burning in my mouth. Why? On just on sight of food. Why? Because it is not a matter of the touch. It is not a matter of a reactivity with our mouth, but it is a reactivity with our sight, with our brain, and with our gut. This is also a functional disease. It starts from the mouth to our whole gut. The whole gut can be maybe hypersensitive, maybe hypermotile, and maybe inflamed, maybe a painful condition, maybe may give rise to spasmodic like condition, may give the may alter the absorbing affinity of our gastric mucosa, may disturb our movement, bowel movement, and cause the constipation, and may cause a bowel syndrome like disease. When we call the Rome syndrome or Rome diseases or the gastrointestinal functional diseases, the first thing which come up in our mind is IBS. No doubt, IBS is one of the major conditions which can be included in the Rome 4. And the IBS is not a single syndrome. That may be in a different pictorial condition. That may be a sensational, but with the sensational differentiation. What is the IBS? IBS means irritable bowel syndrome. Irritable bowel syndrome means we are not pathologically ill, but functionally we feel that there is something wrong in our body. And that also includes the function of our hormones, function of our juices or secretion releases during the digestion process, and function of our microbiota. I have already talked about the microbiota, which is always present in our microbial gut, our gut, and our every place where is the mucous membrane is exist, microbe, biomicrobe are available to save our health. These are the friendly bacteria. which are make colonize themselves in our body, and they are producing certain different beneficial things for our life or our health. See, if we talk about the vitamin B, it means if we not taking the vitamin B, our microbiome can produce or okay, can create the vitamin B. Different things are regulated in absorption, like sugars, carbohydrates, lipids are depends upon the health of our microbiome. It means, in a nutshell, we can say that our senses, our brain, and our gut is are the trika of our body, which can stabilize our mood, which can save ourselves from the certain so many diseases which may advance to the certain um, cancers or alike diseases. If we seek or if we see our patient in this direction, we sort out on the basis of Rome 4 criteria, which is already available on the different website, and you can see that there is certain classification have been made for certain feelings, certain conditions, and we and these are correlated with the homeopathic symptoms, with the mind symptoms, with the bowel habits, with the our craving and our aversion. These are the more beneficial, and we can achieve our the goal to treat the patient very effectively. If you can say that this is not uh, hello, this is hello,
Yes,
is
yes,
that
we
audible?
can. Yeah, yeah,
Yeah.
audible, sir. Audible, sir.
Okay, okay. Because there is also a sound which I have listened that disconnected. What disconnected? I don't know. So,
No problem.
okay. Uh, if you see that if it is not our just a feeling, one can say that it is a psychological effect. If we are thinking about something disease, something disorder in our stomach, we feel that that according to our feeling. But it is not just a feeling. It, it goes to be our genes, and even in the infants, we can see that certain diseases or certain feelings are present in these little children. And in children, this functional disorder is also available. That's why if we see the children, those of our colleagues who are so related with the treatment, providing the treatment to the children or pediatrician like practice, they are well known, well aware that if a child is suffering from a diarrhea, that may be due to otalgia. And if this child is suffering from earache, the first ever symptom may appear in the shape of diarrhea. This is the expression of the nature, and this also denotes that This also transpires that our pain or our conditions are so correlated with our feeling and gut. If we are painful and we can't accept ourselves as a pain, we can see that, we can observe that our bowel movement, our bowel motility can increase. If a person is fearful or under the stress, severe stress, either he can vomit out or he can be suffered from diarrhea. Why? All these are interconnected. Today's our sitting or our session is solely close with our feeling relating to gut and our symptoms appear on our body. Except the Crohn's disease, except the colitis, except the colitis, we can see that all the diseases which are related with the gut or microbiome or gastrointestinal tract are closely related with our mind. And we can evaluate the drug symptoms and medical information very efficiently by using this criteria, which is precisely called as Rome criteria 4. If I may be allowed to add something about the feelings, about our eating habits. So in allopathy or in other system of medicine, we can see that they have no remedy and they are not using anything about anything relating to these diseases. But in homeopathy, we have an opportunity to select a remedy for these symptoms which are not presumed as a disease but the illness. These illness may be something, some subtle life symptoms or subtle feelings. These feelings are very closely related with the mind or brain. Our intestinal motility is also related with our feeling and our you can say that our eating habit or our lifestyle. There are two things which are very important to treat the patients who are suffering from Rome criteria conditions, which are, one thing is a brisk walk. If a person is under 40, 30 minutes of brisk walk is quite necessary to release the all things which can cause the illness of Rome criteria conditions. And the next one is to avoid those products, especially the dairy products, which are closely related with the microbiota of our gut. If we can justify the quantity of intake of dairy products, then we can be able to sublimate or subside the illness of arising from the microbiome. One can ask that how we can correlate with the homeopathy in the principles or according to organon of homeopathy. So I can quote the 192 aphorism of number 192, which have also described about the digestion and its tentacles, which are goes to our body and mind. And if our body mind is quite clear, it means our gut will work quite appropriately. And if we are in the stress or under the gastric burden, we can feel something like this. We can sort out the people who are getting much or eating much. Most of them feels nothing, but the people having eating a least quantity of food can experience the gastrointestinal reflexes. Why? It depends upon the posture. It is also part of our lifestyle, which Hahnemann has also advised in the organon of homeopathy. The lifestyle is also a part of our healthy practices. And if one is suffering from reflexes, it means our sleeping posture will play a part. If we sleep on the left side of our body, it means our greater curvature will go towards the dead, and the reflexes will be the least one. This will allow the stomach to push the all of our chyme towards the intestine, not towards the esophagus. So we can say that all the illnesses which included in the gastrointestinal functional diseases can be treated with the homeopathy as well as with the certain advices which can be perceived from the organon of homeopathy of Hahnemann. In our homeopathy, there are so many remedies which have to be preferred as compared to other system of medicine. Either it may be herbal, either it may be conventional system of medicine. Because our diluted remedies are least side effect pertaining. I am using the least. It means nothing, but there may be some sort of side effect or some sort of after effect or some sort of contraindication. But there is a benefit that it works over the mind, over the origin of the illness. While the other system of medicine, they are just to sublimate, just to reverse the process, chemical process. If someone is suffering from heartburning, there should be a alkaline based salt may be given, or alkaline based herbs or other chemical are being used to sublimate or to revert the process, chemical process. while in homeopathy this is not. If a child or infant is suffering from a diarrhea, and if we see that the remedy is maybe the belladonna, which commonly not related with the gastrointestinal tract, but it works. Why it works? Because we are treating the wiring of which are present in our mind to that. And belladonna, ipecacuanha, these are the in the diluted form. These are the very active non-pharmaceutical or non-pharmacological ingredients or agents to restore our health. I am also using the non-pharmacological. Non-pharmacological means they are not work as a chemically. As people are feeling that that chemical will do that change the such chemistry of our cells, and but this is not in case of homeopathy. We are dealing with the innermost part of where the system is originating. If we are using our diluted remedies, it means we are dealing with the things where they originate. Either may be it from the cellular wall or the organelles of the cell. They will provide a good environment to our body to revert and make ourselves healthy. This is the gist of this session, that homeopathy is closely related with the functional diseases, functionally disturbed condition of our body. Either it may be gastrointestinal or either it may be in any other system of medicine. But in this session, we are focusing on the gastrointestinal tract. And for example, we can say that IBS and IBD, irritable bowel syndrome and irritable bowel diseases, which are common in our people or our population, and people are just taking certain common allopathic or homeopathic combinations or allopathic diseases with allopathic medicines. This is not way to treat the disease, but the homeopathic way of similarity by using the very diluted condition, very diluted medicine or remedies, we can get our health very efficiently. I think that Dr. Herbert, I have closed my session. If there is a question. Hello, Dr. Herbert.
Hello.
This is all.
Can do for 8 minutes more, sir. After that, discussion.
Okay.
Let us go for discussion.
Okay.
If anybody want to ask, anything, please raise your hand and. Sir, thank you for a very nice presentation and a very important thing for a new thing for us to, the new terminology you used, it is good, because new terminologies are always coming, and normally the others are we know, but the new terminologies are very new to us, and it is very nice for you today use that terminology. Thank you, sir. Now, Hamad Hussain, sir. Sir.
Yes, sir. Good evening, sir.
Okay.
Good evening to all. And sir, it is a very nice presentation about microbiome. And it is nowadays, it is very famous. Also, it is concerned with the, you can say, gut and link barrier. So definitely it is very useful, meaningful for our holistic and homeopathic approach. And thank you very much, sir, for your functional disturbance awareness. Jazakallah khair. Assalamu alaikum.
Master Hussain, thank you. This is I think that it is a functional gastrointestinal disturbance. And all the diseases which are not diagnosed as a pathological condition can be included in the functional disturbances. Nowadays, they have excluding it's a functional disease. It is not a functional disease. Now it is going to be added in the diseases as such, actual diseases. So we are passing or we are getting so close to homeopathy in conventional medicine also. But we have left the conventional, the expert of the conventional medicine are doing so. So, according to Hahnemann, that was remained behind. Now, the scientific researches regarding the gastrointestinal diseases is closing to our homeopathy in terms of gastrointestinal diseases, gastrointestinal disease, illness, and the feeling like things. So we are getting more advantages, and we are feeling that we were the advanced in terms of system of medicine or diseases as compared to conventional disease.
Yes, sir. Thank you, sir. Thank you, sir. Jazakallah khair.
Sir, I want to ask you, sir, which are the
Okay.
medicines, normally, which are the medicines are using for a permanent cure, or we can development of that condition, we can curtail the development of that condition?
Normally, all the medicines of homeopathy can be the remedial remedies for all our gastrointestinal tract. I especially experienced about certain uncommon remedies about the to get the better result. If I feel that in little children or in the infants, I used to use the belladonna for all such conditions which relate with the gastrointestinal tract. And I have experienced the belladonna 6 to belladonna 30. All the potencies in between are effective to augment, to relieve the symptoms of children's diseases. Either they are suffering from diarrhea or they are suffering from a little bit thing is a key point is which should be available in the children, that they wake up during the sleep. They cry during the sleep. So it is the one symptom that leads me to give them the belladonna. Likewise, I am using the aconite, I am using the gelsemium. One can ask me that why not I am using the certain remedies which are predetermined for the gastric organ diseases. chamomilla, like veratrum album, like other in China. But I feel that after going through the Rome criteria or gastrointestinal diseases literature, I will be able to choose the remedies which are particularly effect on the nerves, on the cells, on the brain. And these are, from these, I get benefited in my practice.
One more question. I have seen that many cases of gastrointestinal problems may lead to some heart complaints and everything. So the acidity and it makes vascular disorders and what your opinion about it, sir?
In many cases where the people are complaining about the heartburning and other allied symptoms, I always adopt the protocol comprising the two things. One thing is appropriate remedy may be given to the patient, and second thing is to avoid from the dairy products. Our dairy products are exclusively affect our microbiome or biota available in our gut. That's why I stop them. I can allow the patient to take achar or pickles or other things which are normally restricted from these people. I can allow they take something barbecue and take the other things, but
Hello.
the but the but the sugar or carbohydrate and dairy products are closely I ever stop them to the patient and got certain benefits from it. In homeopathic medicine, I preferably, in this case, in heartburning or certain diseases, particularly relates with the stomach or upper part of the gut, I prefer the iris, which have certain common symptoms. In my region, these are the common symptoms, and it works in every patient.
Thank you, sir. Now, Dr. Naveed Awan, please unmute. Unmute, sir, and ask. Okay. You can ask, sir. Naveed Awan, sir. Sir, you can talk. Oh, I think that it is by mistake here. Now, Ahmad Hassan, sir. Ahmad Hassan, sir. Yeah.
Yes. Sir, dairy products are not allowed for microbiota, but what about sir, probiotics product? Is it useful?
Yes, it is useful. Probiotics are not dairy products. They are the byproduct of the dairy product. They are not dairy products.
Because last week there was one webinar, so our respected one lecturer also told about that use the pickles and this because it will give the fermentation and more useful things. Thank you very much. Assalamu alaikum.
Yes.
Good evening, sir.
Okay.
Good evening.
Okay.
I am audible.
Yeah, you are audible.
Okay. Good evening, all the honorable team of IFPH. and especially today, guest of honor, Dr. Elahi Bux. Very beautiful topic and very well explained by sir. It's a long time to see such a topic, which is today the burning issue, and mostly the people suffering from this have to suffer a lot. So thank you very much, sir, for giving the more suitable and very fruitful information about the topic. And what is the role of the homeopathy? You have very well explained it. Thanks a lot, sir, and congratulations to you for putting the very nice effort on this topic.
Thank you, Davidavan.
Thanks, sir. You're welcome, sir, please.
Or anybody want to ask?
Sir, can I ask one more question, please, here?
Okay.
As you have related master degree in the topic, and you have selected a very vast topic here, as you know, that it is a very such a topic which is incurable in the other type of the sciences here. So can you, sir, please explain that today's science and today's research, how much it is possible to cure and what is the possibility of its cure? Please, sir. Thank you.
If you want to ask me that how it works, how we use the Rome criteria for the diseases which are incurable, commonly incurable. It is, I think it is a start, or it is the initiation of the feelings like this. And we, conventionally, we have achieved that certain feelings can be converted in the pathological lesions and can be caused even cancer, even grave diseases like intestinal colitis or other alike diseases. And we can see that there is no treatment in any system of medicine, but in homeopathy, we can hope, because we are not dealing with the diseases. We are dealing with the patient. And with this hope, we can treat the patient very efficiently as compared to other system of medicine. Because we are using such a remedies in such a dose which is totally free from any unwanted symptoms, but it can affect our body or our economy of our body, that can not only prevent but can revert the system of our body. Physiologically, we can be healthful. We can be achieved the healthful or after treatment of homeopathy if we have been treated with the principled homeopathy.
Well explained, sir. If anybody want to ask, please raise your hand. Sir, how Crohn's disease and is there any relationship with this condition?
Dr. Hubbard, I have no experience of the Crohn's disease ever in my practice, and I am not mentally prepared to explain or to treat the patient of Crohn's disease which have came to my clinics, and I have apologized them that I can't take these type of diseases and I can't treat because I was not prepared. If it is my normal practice that if I am not prepared for such a type of condition or pathological condition which are out of my knowledge, I ever excuse the patient that it is beyond my scope and it is still beyond of my scope. and I will try to go through the books, and if there will be some sort of living way, if I will try them.
Thank you, sir. Now, Dr. Manoj.
It's definitely nice presentation and an important thing too. Because we all know that homeopathy is the lone system of medicine where you can depend the disease phenomena totally. Everybody talks widely regarding the psychological aspect, the sociological aspect, X aspect, Y aspect, Z aspect. But nobody is able to capitalize on this, the natural phenomena or the real experience of the patient. I think homeopathy is a lone system of medicine which is capable of capitalizing on the subjective symptoms of the patient. So in all these conditions, definitely the patient will have his own diseases. That is, Hahnemann used the term aggravation of his own disease. His own means the characteristic symptoms, the characteristic features of a particular disease. If this same patient approaches another physician, they will say this is psychological conditions. You may go and consult a psychologist, psychiatrist, and prescribe some other medicines, then give some counseling, but without a single dose of medicine. Just as like Gahi sir said, the Belladonna, Bryone, A to Z, all medicines are capable of this. Moreover, all these things were proved during drug proving also. Almost all medicines, as Hahnemann said, invariably producing mental symptoms, the potentized medicines. So these are the essential features of medicine, and these essential features of medicine are really utilized only in homeopathy. That is advantage, and your presentation is also a nice one. This is just like Dr. Hubert De Silva said, it's a new exposition to us, because these are a lot of developments we must accept. We are not at all against the other systems of medicine. But what we are disagreeing is the methodology, the idea, the logic behind. That means they are seeing the human being body as a machine, following the Rene Descartes principles. That is a long area we are not at all accepting or agreeing with allopathic system of medicine. That's what I can say. Nice presentation. Thank you.
Thank you, Dr. Manoj. And now, Dr. Ram Pravesh. I think that he's watching very carefully, but not asking anything. Sir, you can unmute, sir, and ask.
Okay, sir. बहुत बहुत धन्यवाद। बहुत अच्छा बताए होम्योपैथिक जो treat the patient not the disease according to law of homeopathic, fundamental law and natural law, और यहाँ तक कि जो है एकदम राइट सही बताए हैं हमारे सर, जो कि फंक्शनल डिजीज के बाद जो है स्ट्रक्चरल डिजीज आते हैं एकदम निश्चित। और जब तक, और ऐसे भी कहा गया पेट साफ का बीमारी माफ। तो बेलाडोना पर भी बहुत अच्छा बताए हैं। हम तो हिंदी में टॉक कर रहे हैं। बेलाडोना भी बहुत अच्छे हैं बच्चे के लिए, और हर बीमारी में जो है, वैसे हम बेलाडोना ज्यादा करके बर्ड्स, बी से बर्निंग, आई से इंफ्लामेशन, आर से रेड, डी से डिलेरियम, इट्स कॉल्ड नेम ऑफ बेलाडोना। सर बहुत बहुत धन्यवाद, आप कहे थोड़ा जो भी हो बहुत अच्छा बताए हैं सर, के लिए बहुत बहुत धन्यवाद। ठीक सर, ओके।
Now, I call Dr. Hariharan sir. Unmute, sir. Sir, you can, okay.
Okay. Sir, your class is very nice and very good. Appreciating you. You are having a lot of experience, and from that experience you narrated the class. Really, it is we must studyable all these points. See, homeopathic medicine, you know, it's subtle nature. And the subtle nature of the medicine acts upon the subtle nature of man. See, these two are dynamic. When simillimum comes, the patient recovers. Otherwise, it is not. It is the fundamental principles of homeopathy. So, in my opinion, in my 45 years experience, I dislike to name the disease now. See, by studying materia medica and pathology and practice of medicinal pathology, and we name the disease. It is utterly a nonsense, I think. Clearly take the symptom. In IBS, why you are calling it IBS? See, different patients have showing different type of symptoms in IBS. Sometimes dairy products show some idiosyncrasy to that patient and causes discomfort. Certain patients it is not. Certain patients showing, see, fried items having disturbance and showing the IBS like the symptoms. I will say like that. IBS like symptoms. For studying, we are saying it is IBS, it is typhoid, it is cholera, it is COVID, these are all. So I like to say, see, without naming the disease, you study the materia medica and find out the simillimum and find out a remedy and administer to the patient and find the potency. Potency only we can't comment. That is from experience. By you whether to give 30 or 200, 1 10 more. See, in certain cases, 30 will act the mind. In certain cases, see, higher potency will act. That I mean, 10 50 will act. That depends the sensitiveness of the patients. So start with lower potency and find the sensitivity and fix the potency according to that. That is my comment regarding it. Sir, your class is nice. Okay, thank you very much.
Thank you, sir. You can also say the word of thanks.
So, sir, come again. We are very glad to see you again. Very thankful to you. Okay, see, regarding IFPH and see the listeners, for them, I am saying thanks to you. Come in. Okay, good night.
Very nice. So, sir, it was a very good information you have given us. So thank you very much. You are always welcome, and such personalities are coming to our platform is great for us. And you are most welcome to all our time. Now it is concluding here, the 1047th day of our continuous webinar. Now I invite for the next, where we are concluding here, and now we are going to our local language, Malayalam. So I welcome inviting Dr. P. Shaila to do the moderation.